from the News Channel 5 network. This is OpenLine.
Monday night here on an open line, everyone. I'm going to adjust my chair so I'm a little lower. Rhori Johnston with you, filling in for Carrie Sharp here on a Monday night, and we are pleased you are with us. First day of November. Can you believe it? It is here, and if you watch Breeze forecasts, you know it's going to feel like November coming up. We have an important topic to get to tonight. For some reason, it has definitely become controversial, but we are going to talk about the COVID-19 vaccine, specifically, as you see on the screen, booster shots and what you need to know. There's a lot of misinformation, disinformation, whatever you want to call it, confusion, but we want to clear things up tonight, and one of our favorite experts has agreed to join us after a long day at work. She's still in her office over there at Vanderbilt, and it is Dr. Aima Ahonkhai. She is an infectious disease expert, has been with us before. Doctor, thank you so much for being with us.
Thanks for having me.
Yeah, hard to believe it is November 1st. Here's the story that I was telling someone just recently. I had to do a Zoom call with a group of students at Lipscomb, and I used one of my coworkers' offices here, and this is a coworker who's been gone working remotely since the beginning of the pandemic, and I noticed on her desk she had one of those daily tearaway calendars with a quote on it. And talk about frozen in time. It was her calendar still sits there, March 24th, 2020.
Oh, wow.
It's hard to believe that it's been this long, but here we are. Before we even get into the booster shots, let's just talk about how far we've come from a medical standpoint from, it was almost 2 years ago now. I think November of 19 or December of 19, when we first started hearing about COVID-19. Tell us about what we've learned and just in general this process of where we are now, November 1st, 2021.
Yeah, I'm happy to do that. Thanks again for having me on.
Sure.
Yeah, as we all remember, when we first started hearing about this novel coronavirus at the very end of 2019, it was just that. It was new. It was something we hadn't seen before. Many of us remember we were terrified in our homes. We were doom scrolling, watching media and hearing all these cases, seeing people in high-risk groups, elderly, people with multiple chronic diseases, really dying at high rates from this infection. And fast forward to where we are now, we have a very effective, more than one, very effective vaccines that are up to 90% effective in preventing hospitalization and serious complications. We have treatments that have been approved for this virus. We have antibodies to prevent serious complications once individuals are infected. So we have made tremendous strides in, from a new virus that none of us had ever heard about to where we are now in a really rapid period of time. And I think it is a testament to what can happen when we all kind of work together on a pressing public health issue to find solutions very quickly.
And I think I mentioned this to you last time, or maybe some other experts. I'm all about doing research before I buy a product or before I do something. I just love looking at reviews and looking at sources of information. So my personal choice, the one that I made after talking to my doctor and reading up, was to go ahead and get vaccinated. So I got the Moderna vaccine and got the follow-up. I had some side effects after the second shot, but otherwise, knock on wood, I felt fine. It's made me feel protected. Obviously, a lot of people have chosen not to get vaccinated, although those numbers have slowly, especially after the surge of Delta in September, more people started getting their shots. Do you think as time goes on, and personally what I believe, everything that I've read, even the most recent study, which was widespread, really kind of showing that yes, this vaccine has been pretty effective compared to the side effects. It's looking really good, isn't it?
Yes, the vaccines that we have available for COVID-19 are very effective at preventing severe disease, preventing complications and death from COVID-19 with really few side effects. That's true, and that's held up over time.
Yeah. So then we move in. We'll get to the boosters for sure, but I was personally not surprised that the biomedical companies and the government together were able to jump on this and produce a vaccine in what seemed like record time, but really from a biomedical and a technical standpoint, we had been studying coronaviruses, that broader field, and just where we've come in technology, being able to put this together. Now, it took the government to come in and take away some of the roadblocks and try to speed it up without, giving up safety. But it did work, come together. Still, obviously, I know we may get some phone calls tonight from people who still aren't so sure. But again, do you think time is on our side as time goes on and we get more and more research?
That's true. I think, as you mentioned, there are people who want to know what are the long-term side effects, what are the long-term consequences, and it's only length of time and follow-up that can answer those questions for us. But the things that we need to know up front in terms of determining risk and benefit, we've definitely studied quite rigorously, guided by the FDA, which really lays out some really stringent policies for us to be able to roll out vaccines like this in the community. But yes, long-term follow-up, it's only time that will give us the opportunity to see what long-term consequences are. And
again, I'm going to go off topic just a little bit, but I just want people to understand your resume is so very impressive. And I know your focus training started with HIV medicine, and I grew up in the 80s when AIDS, the epidemic came out or whatever, and you look at how far we've come, obviously far too many lives lost, but you did a lot of research and clinical research, and I believe some of it in Africa, right? Does this kind of studying and research, does it help you now when we deal with something like this, like COVID?
Well, I think that we learn lessons that are applicable, across diseases. Like you said, despite all of the efforts that have been made towards trying to find an HIV vaccine or cure, that has not been the case. But when the whole world is watching and the whole world is affected, we see what can happen. And I think with the COVID vaccines and treatments, we've certainly seen that. But I think that there's certainly lessons learned in thinking about when we talk about disparities in health outcomes. We've seen things with HIV that are also seen with COVID-19, how to minimize disparities, how to improve our access to treatment, to minimize those disparities. And those are on a national scheme, but also on a global scheme. So we see disparities in vaccine distribution, which can become a problem if we're thinking about how to address pandemic control. So there are definitely lessons learned across disciplines for these two different viruses. Yeah,
and the hope is that, and not really if something like this happens again, it's more about when we face something like this again, that hopefully we'll be much better prepared. Then the public, maybe the mindset of people will be a little more prepared for it,
Yes, I agree with you. I hope so. I mean, we sometimes we have short memories, but the goal is that we learn from the lessons from this experience, that our public health systems become stronger, that we don't have to reinvent the wheel the next time we're faced with a public health crisis of this proportion. So I agree. I hope that we can really learn a lot of these lessons, not just on the science and the science that brought us together in the way that happened so nicely for COVID-19, but thinking about how we roll out treatment effectively, how we communicate to the public in ways that are clear and consistent to minimize disinformation and misinformation, how we address things like racial disparities in distributing treatment. So I think there are a lot of lessons that have been on the forefront for this COVID pandemic that we can learn from and that we should learn from, and not have this play out again.
Yeah, not let our emotions get the best of us. All right. Dr. Aima Ahonkhai from Vanderbilt is with us, and as I promised, we just wanted to get through, kind of chat a little bit, but our topic tonight is the COVID-19 booster shots, which are widely available to specific populations. We're going to run through what's available, whether or not you're in one of those groups, and if you'd like to call in with questions, we'd love to hear from you. 737+ is the phone number. We will be back after a short break.